Today I'll be presenting my second dissertation project, which is titled Robust Estimation under Outcome-Dependent Censoring in Huntington disease. And I'm focusing for like estimators for high censoring and low censoring rates. So today's talk is going to take about 45 minutes. So I'll be like explaining like what is Huntington disease, and then kind of like after that follow up with like the statistical problem, and leaving the presentation with with final remarks as well as like potential ideas for collaborations. So as I was mentioning, I completed my dissertation or my PhD just like a couple months ago, back in August. I was like one of you guys like 3 months ago. So it's kind of scary to be like now the postdoc and like not a student anymore. But I did this project with my dissertation advisor, Tanya Garcia, in collaboration with Yanyuan Ma, which she's a professor of statistics at UPenn, and Karen Marner, she's a Huntington disease specialist at Columbia. And I first want to like thank the National Institute of Neurological Disorders and Stroke, as well as the National Institute of Environmental Sciences Health Grant for making this research possible. So what is Huntington disease? So Huntington disease, like the genetic definition, if you were to like look at the genetic strand, and then if you were to focus on this region, which is called the Huntington gene, Huntington disease is kind of like characterized by a expansion of CAG on this like part of like your gene. So if you have like more than 40 CAG repeats or 40 or more, you are guaranteed to develop Huntington disease like during your lifetime. And we're interested in studying Huntington disease because there are currently no treatments out there that delay or stop the onset of symptoms. And it is pretty severe. For example, it has kind of like the worst of like various diseases. For example, with Parkinson's, you have kind of like the motor disability in which you cannot kind of like stop your hands like shaking. For Alzheimer's, you have kind of like the dementia, the cognitive decline. And then you also, these patients also like develop psychosis. And back at UNC, like part of my training was to go to these Huntington disease clinic visits, and I would kind of like witness like individuals coming in with like varying degrees of kind of like psychosis episodes. And so we're interested in developing potential treatments for this disease. And one of the ways in which we can do this is by measuring their cognitive health. So one of these measures that we're interested in is the Stroop word reading test, in which individuals have to perform a test that look like this. So I'll have kind of like a a deck of flashcards, and then I'm gonna be kind of like racing them, and I'm gonna ask the person to read the name of like the color, except of like saying like what the color is. And so you have 90 seconds to like do as many of these as possible. And a higher score indicates better cognitive health. So this is one of the ways that cognitive health is measured in Huntington disease. And there are like a few longitudinal prospective cohort studies investigating Huntington disease that are non-interventional. Today I'll be focusing on the PREDICT-HD study, in which we have about 1,000 individuals for which we at least have 40 or more CAG repeats. But before being able to kind of like understand how does disease progress over time, we need to like pick a time metric. So one of the defaults is to like just pick age. So I made this plot by the Stroop word reading test, and each of kind of like these lines represents like one individual. And if we were to like do this analysis based on age, we would see that there's kind of like a steady decline, and then it kind of like accelerates after like the age of 70, although we have like very few observations past that. So it's probably linear, right? But then if I were to plot it with respect to time since baseline, we have like a completely like different picture as to individuals are progressing at a very linear rate. So there's like no curvature as in comparison to like the previous plot, but also a baseline if individuals are enrolling at different ages, like what does baseline really mean, right? So we start to kind of like question, okay, what is the right timeline to like model the trajectory of cognitive health among this population. And then the last one is time to diagnosis. So for this one, we need their age at diagnosis and then anchor every single individual by their time to diagnosis. And if we were to like analyze the data this way, we can like start seeing that as individuals are approaching a diagnosis indicated by this red line at 0, we can see that there's kind of like a steady decline and then a more accelerated rapid decline near diagnosis. And then after a few years of diagnosis, you go back to kind of like that more steady decline. So we can see that there's an accelerated like decline if we were to model the Stroop word reading test as a function of time to diagnosis. And so the before 0 represents how much time you have until you get diagnosed. So like -5 will represent that you're 5 years away from a diagnosis. And then +5 means that you're 5 year post the diagnosis. And so we're interested in focusing on this type of time scale because if we were to like evaluate specific treatments, we can target like right before like that accelerated decline, which would allow us to delay the onset of symptoms and kind of like really target like a specific timeline that one is shared among all individuals. All of these individuals are like sharing the same timeline since we're kind of like anchoring them by the time that they get diagnosed, which makes science a little bit more precise than if we were to like model it as a function of time since baseline. So I just showed you kind of like the 3 plots. And so like the last plot kind of like shows this kind of like this sigmoidal curve. And then the other ones, they show kind of like different results or like a different line. But if you were to like compare like how many more tiny little lines are in the first two in comparison to the last one, on the last one, we're only using about 30% of the data because for like 70% of the individuals, they did not develop Huntington disease during the study time frame. So even though we know kind of like what their scores are, what their little line is, like we don't know where to censor it. So that's why we're not able to use this data. And as a result, we're only like using 30% of like the original data. And for the predict HD, it's above 70. It's like 77% actually, the percent of right censoring. And among all of the other like large longitudinal studies of Huntington disease, we see like censoring rates going up to like 80%. So like this is kind of like very common in neurodegenerative diseases because they progress very slowly. And by the time that they were to develop like enough symptoms to be kind of like diagnosed with like the disease, they're already like past the study limit in which they were observed. And so just kind of like further noting on that, we observe an individual's age of diagnosis if they are diagnosed between the study baseline and the study ending. But if an individual were to be diagnosed or quote unquote, or like develop the disease after the study is ending, then those individuals are right censored. And that's kind of like what I'm referring to the right censoring process here. So I already told you kind of like the motivation of Huntington disease, like what's the type of data that we have and the research question of interest. Now, what does this mean in terms of kind of like statistical terms? So I'm not the first one to kind of like look into this problem. Brad Pitt was actually the first person. So there's this movie called The Benjamin Button Process in which Brad Pitt's kind of like aging in reverse. So starting out at like very like old age and then he like turns into a baby. And our colleagues up at Michigan investigated or labeled this type of like process of analyzing time in reverse as the Benjamin Button process. And when my mentor was just like, oh, just go cite the Benjamin Button process, I was just kind of like Googling and all I could find was Brad Pitt, which made me very confused. But today I'll tell you that you have to Google revival analysis to like get relevant papers about this. And so this type of problem is very common. For example, figure number 3, it represents this study in 2010 in which they were interested in modeling the hormonal levels of women as they were approaching menarche. And then on figure number 4, it's actually a JASA paper that they were investigating medical payments as individuals were approaching death. And then more recently in 2024, there was this recently published papers in Alzheimer's disease that they were investigating how does different type of like markers evolve as they're approaching a clinical diagnosis. So there's a deep interest in how health markers and medical payments, among like other markers, they evolve as individuals are approaching like some type of like event. Because if you were just to like measure them at a specific like um, at a general time scale, like results may not be very meaningful, and you may actually get like misleading results about like how disease progresses. And this information is useful in clinical care management and development of clinical trials aimed at developing treatments that can potentially delay the onset of symptoms. So we can consider this problem as a regression model to keep it like very simple. So we may have an outcome yi, which is equal to a mean function of x and z parameterized by beta. So this can be a linear and nonlinear function. And then we have an error term. So this is just like typical bread and butter linear regression model. And the statistical problem is that instead of observing X, which we need to anchor every single individual, we observe W and delta. So we're interested in estimating theta, which is beta and sigma, using the observed data, Y, W, delta, and Z, where the outcome Y and Z are the fully observed covariates are always observed. But for like X, the time of diagnosis, we sometimes observe the minimum between like their age of diagnosis and their censoring age, C. And delta, which is the indicator that they were diagnosed during the study timeframe and that we observe their age at diagnosis. In other words, we want to like estimate the parameter set of interest without knowing the full but unobserved data, which would constitute Y, X, C, and Z. So this is what we labeled as the right-censored covariate problem. Now, can a right-censored covariate be treated as a missing one? And this is kind of like one of the first questions that I got from a very senior statistician, and I was scared, and I was a baby PhD student. So I really thought about it because in the missing covariate setting, we observe the data Y, X, R, in which R represents the indicator function of observing X. So when R is equal to 1, then you observe X. When it's 0, then you don't observe X. And we compared it with like the observed data for the right-censored covariate problem. And after spending the first 3 years of my PhD on this problem, I guess it depends, our favorite word, right? So in certain settings, you can actually introduce bias, and this is something that we later like established on this on my first dissertation paper called Establishing the Parallelism Differences Between Right-Censored and Missing Covariates. And don't worry, I'll be kind of like sharing these slides after my presentation. But in this paper, we investigated the outcome-independent censoring setting in which the censoring is independent of the outcome given X and Z, and then two forms of dependencies between the censoring process and the observed age of diagnosis, conditional on the full set of covariates. And on this paper, we validated 3 estimators that had been used in the field, being the complete case, the IPW, and the MOE. And I was able to propose 3 new estimators for this setting, being the augmented complete case, the modified augmented complete case, and a AIPW estimator. So now what's dependent censoring? So dependent censoring is important. Go ahead.
Question.
Oh,
Hi, Jesus. May I ask a question just because I'm confused? Could you give an example of a right-censored covariate? I mean, you flip time, and so things are already a little confusing.
yeah.
If you don't mind, thank you.
Yeah, of course. So like in the area of like Alzheimer's, for example, there's this interest in kind of like modeling the amyloid decomposition on the brain on offsprings. And one of the important variables that may help explain that is the mother's age at onset of Alzheimer's disease. But like if you were to only have one visit, and if in that visit you measure both like the amyloid decomposition of the brain of the offspring, and then you ask the mother when did you develop symptoms, like some of these mothers, they may not have developed the symptoms yet. So in that case, like the covariate of interest is mother's age at onset of Alzheimer's disease symptoms. But for some cases, that age is right-censored because mothers have not developed the disease yet.
Oh, interesting. Thank you.
Yes, thank you. Any other questions? Thanks. So now we deal with so now I explained a little bit about like what maybe like some of the assumptions in the past I was making. Now I'll be explaining kind of like those limitations. So most of the estimators that I've kind of like investigated assume outcome independent censoring, which are different variations. The first one is that C is conditionally independent of the outcome given the X and Z. And then a different one, which is C is independent of both Y and X conditional on Z. So this assumption is reasonable when the censoring arises from administrative factors. For example, if you kind of like begin a study and then you like set the specific end of the study for like a specific date, and then individuals are just like randomly censored because they just didn't develop the symptoms, then that would be kind of like a form of like random type of like censoring. But if you have kind of like censoring being explained by different factors, potentially like social demographic characteristics, some people here would maybe say that this is a type of like differential censoring problem. Then in this case, then this assumption may not hold. And this assumption does not hold in Huntington disease when measuring composite scores of cognitive and motor and functional health. For example, we have the Unified Huntington Disease Rating Scale, which I'll show you here. It's kind of like this composite score, uh, comprising of like four different measurements, being like the total functional capacity, the total motor score, the symbol digit modalities test, and the strip word reading test. And then individuals also get diagnosed with the disease using some of the same values. So there's this like interest in modeling cognitive health or a lot of the different markers uh, as a function of mild cognitive impairment because cognitive impairment comes before motor impairment. So if we're able to kind of like investigate treatments that postpone the onset of cognitive impairment, then that would lead to like a delay in motor symptoms as well. And I'm going to highlight these two. But as you can see, for mild cognitive impairment, you need to satisfy at least four of these criteria, at least two of these four criteria in order to be to reach the criteria for mild cognitive impairment. But also like the outcome, you see these same type of like measurements. So if an individual has a very good cUHDRS, like a very good like outcome, then that will lead to like potentially very high values of the SDMT and the strip word reading test, making them less likely to be diagnosed during the study timeline, which will lead to probably like differential levels of like censoring among some of these healthier individuals that are presented at baseline. So individuals with high cUHDRS scores may not be diagnosed during the study period because it may take longer for them to be diagnosed. So this assumption that we were making about the independence between C and Y may not hold, and estimators that rely on this assumption will lead to bias. And it's important because we may want to kind of like estimate the speed of one of this regression model. So we need to like investigate like estimators that will allow us to do this while considering the dependence between the censoring mechanism and our outcome. So our contributions. So for our contributions, we can think about like we want to like develop a method that is both like robust, meaning that we can specify some things, but we'll still like achieve consistency. And we also want an efficient estimator that will give us like those very like narrow confidence intervals. So you want an estimator that is like on the top right corner over there. So that was our goal. And I'll give you an overview of the contributions, and then I'll repeat what I also did like after a few slides. but I validated this IPW estimator that had been proposed out in the field maybe like a few years ago. But they had like some inconsistencies when it comes to like what to include and what not to include in the propensity model. And then I also developed a AIPW estimator, and then I established that the maximum likelihood estimator from like my first paper is actually consistent in this setting. And then these other estimators being the complete case, the augmented complete case, the modified augmented complete case, and this conditional mean imputation estimator, where we replace the estimated means of their age of diagnosis whenever it's censored, it will actually lead to bias. So we also established that these were not consistent. So I'll begin with the IPW estimator that was initially proposed. We can define the probability of observing. Go ahead.
So sorry, just before we get off the estimation,
Uh-huh.
I'm just curious whether the fact that the measure of cognitive health is a composite, whether that affects the analysis. Because at least on people assessments like BMI,
Mhm.
like in where the case we want to be a causal variable, at least the last debates, because basically there's different ways to intervene, like it could have totally different consequences. So there's just a function of height, weight. So I'm curious if that's something that also affects this, or because it's not something you're trying to intervene, if that's just irrelevant.
Yeah, and I think that this kind of like highlights very good kind of like my place in the department, because I do not consider myself being a person of like causal inference. I'm just like, do we observe or do we not, and then I just kind of like came here and I'm doing kind of like this work in the area like causal inference. So here I'm not distinguishing whether like certain of these measures are exposures or not. But I think it would be interesting to like potentially like investigate the temporality of kind of like some of these measures and how integrating them into like a composite score, they may affect some of these results. But for now, we're kind of like not making any assumptions as to whether any of these single like individual components of the composite score are like I guess like affecting like the overall result.
Well, I guess, I mean, it depends what you do with it. I'm still wrapping my head around it, but I mean, even if you just condition what it means, you could have all these different combinations of components and have the same score. So that sort of might still affect your analysis, even if you're not like.
Oh, I see, I see.
exposure.
Yeah. So I guess I see more of your question is like if, I don't know, let's say for example, like measure 1, 2, and 3, there's 0, and then like the last one is 1, and then for a different individual, the first measure is 1, and then the rest are 0. Like whether that might have like kind of like a effect on potentially like the interpretation or the analysis. And I think that's a very like good question, and something that I did not kind of like look into this project. But I think I would be like more interested in following up with you.
I like this question.
Go ahead, Helen.
Um, Thank you so much. I'm wondering if you can give some intuition about when we deal with outcome dependent censoring, what are these consistent estimators doing that these inconsistent estimators don't do? And how does that bias consistency under outcome dependent censoring?
Oh, that's an excellent question. And then that's actually my next like 4 slides, so I'll be happy to answer that. Okay, so jumping right into your question about like what are my estimators doing that potentially the other ones are not, and one of them is like really nailing down on these set of assumptions in which potentially like the censoring is not independent of like the outcome Y given X and Z. And so if we start like defining what the probability of a complete observation is, we can take this approach of defining it as an integral, in which here we're kind of like assuming, okay, we're observing Y, X, and Z, and then our random variable is C. So if we define this conditional probability as C given Y, X, and Z using our assumption number 1, then we're able to kind of like drop the X from the second to the last line, and we're able to obtain this formulation of the probability of observing a complete observation. For previous forms of this probability and the other estimators, we have like that C and Y, they're conditionally independent given X and Z. So Y typically goes away when it comes to kind of like defining this probability of a complete observation. And that's kind of like one of the main ways that the estimator kind of like changes. There are like other differences that follow because we use this probability to define a lot of the different components of like the augmentation terms, but this is kind of like the main way in which these estimators may be a little bit different. So the estimating equation for the IPW estimator can be defined in this form, which is the summation of basically the score function. So this S of theta is basically the partial derivative with respect to the log density of the f of y given x and z distribution. And so when delta is equal to 1, meaning that we observe x, we are only taking like those contributions of this estimating equation. And when x is censored, then delta is equal to 0. So we kind of like just do not consider any of those contributions in the estimation of like theta. And so just to be precise, theta, the IPW estimator or like theta hat IPW is kind of like the solution to this system. Now we can consider the AIPW estimate, which has kind of like this general form. The first component is the IPW estimator component, and then the second component is this augmentation term. So this augmentation term, we can see that there's kind of like this like nasty or ugly looking like psi, which is a function of y and z. And here on the work, we established that regardless of like what we specify y and z is, we'll achieve consistency as long as the probability of observing a complete observation is correctly specified. But just because we can pick like any function psi, y, z, it doesn't mean that will lead to like higher efficiency results. The component that will give us higher efficiency is this form, which is a ratio of two expectations. And as we can see, like this probability is showing, this pi is showing on this form of like the augmentation component. And that's kind of like where like some of this dependency with y is kind of like manifesting. And not just like the probability for like defining the IPW component, but also in the specification of this augmentation term that will lead us to like higher efficiency results over the IPW estimator. But if we don't correctly specify that function that I just showed you, we're not able to kind of like compute that ratio of like expectations correctly, then we may have consistency, but our like estimates, they may be like more variable or less efficient than our IPW estimator. So for this one, we decided to go like a step further and we defined this lambda AIPW, which we can see here. So this lambda, we can define it that for any function of this part highlighted in yellow, we can guarantee that we'll achieve higher efficiency results over the IPW estimator. And this took me like, I don't know, maybe like a year and a half to come up with that. So don't worry too much on it. Just know that when we select any choice of this psi, y, this psi AIPW, we can select the corresponding lambda, which will guarantee us higher efficiency results over the IPW estimator. And on the paper for which it'll come out soon, I developed kind of like this closed form solution, which improves computational costs. Now, finally, we have the maximum likelihood estimator, which the first component is the complete case estimator. And then this additional component is this component that is related to the sensor data. And this is also like a ratio of two expectations for which we can kind of like consider. The first one is this arrow that I'm pointing is that's the score function with regards to like the likelihood, the log likelihood of like the outcome model. And then we have the density of y given x and c, which is the density of like our outcome model, and then the density of like the age of diagnosis. So we need to like have all of these correctly specified in order for like the maximum likelihood to be consistent. But the maximum likelihood estimator is kind of like a good option given that it has like the highest efficiency of all estimators when it's correctly specified. And I just wanted to know that we define consistency, but if we take the expectation of this entire equation and we are able to show that it's equal to 0, then we're guaranteed to have consistent results. Well, we also need to like add some other regularity conditions, but that's typically like how we prove consistency for like these type of like M estimating equations. And for this estimating equation, we show that what difference for like the independent censoring case to this case is that each individual component is not equal to 0, but the aggregation of the expectations of like the complete case estimator and then the censored data term, like that aggregation, the expectation is equal to 0. So I already showed you like enough like scary formulas. I'll just kind of like summarize it with what do we need in order to like achieve consistency. For the IPW and the AIPW, we need the distribution of the censoring mechanism to be correctly specified so that we can correctly specify the weights. And for the maximum likelihood estimator, we need the density of the event time, meaning the f of x given z. So under high censoring rates, we're able to, I'll go ahead and answer your question in just 1 second, Helen. So for high censoring rates, we observe the data y, c, and z most often. And so we're able to get a easier and better estimate of our f of c given y and c. And for low censoring rates, we observe x more often than c. So we're able to obtain a better estimate for the f of x given z distribution. So these are soft recommendations, meaning that there's kind of like no proof for us to be like, hey, you should definitely pick this one all the time. But we kind of like show this on simulation results. But under high censoring rates, the IPW or the AIPW are suggested recommendations given that we're able to estimate the nuisance parameters that are needed for consistent results, whereas for the low censoring rates, the maximum likelihood estimator may be the better choice because it achieves consistency when f of x given c is correctly specified, and it also achieves like the best efficient results out of the estimators I just described. Yes, Helen?
Thanks so much. I think I might be confused, so it would be good to get some clarification. Um, I'm curious how you identify or even estimate the probability of censoring given y and z, that first nuisance function you need to specify. Because when I think about it, like if someone's censored, I definitely don't see their outcome at the time that they're censored. So how would I get this conditional distribution?
Yeah, thanks. So I guess maybe I'll go ahead and split it into like two. What is the type of estimate that we want to use? And I guess like talking more about like the data of the sense of like what is the type of data that I need. From like the estimation point of view, you can either like pick a Cox regression model. In this case, in this presentation, I show results when I modeled this C given Y and Z as a Weibull accelerated failure time model. Given that it has like nice parametric properties whenever it's correctly specified. So we're able to kind of like obtain like the parameters of a Weibull accelerated failure time model, and then we can define what is kind of like that survival probability by treating C as the time in the model as opposed to kind of like the event time, which is the diagnosis, which is generally done. In regards to the density when it comes to the I guess like related to your question, in which if you have a individual and at the last visit they are censored, then you have to kind of like make analytical solutions as to like whether you may want to pick the outcome value for like their composite score, like at the beginning of like the study, or maybe like the last observed outcome value of their age at diagnosis. I don't know if that makes sense.
Oh, so are you using like observations close to when they were censored to impute what their Y would have been at the censoring time? Is that the idea? I guess I'm just seeing like at the time that they're censored, I wouldn't be able to observe their Y or outcome value.
Well, for this study, we like obtain the Y values at baseline. And so like if we like choose like the Y values at baseline, then we're able to kind of like observe the Y values for every single individual. And then we just obtain their censoring ages when they were last observed, given that they didn't, given that they were not diagnosed with Huntington disease by the time the study ended.
Oh, I see. So their Y values are taken at baseline and they're the same value throughout the whole study.
Yes.
That makes sense. Thank you so much. Sorry about that.
Oh, no, you're good. Thank you for the question. I'll just go and show you like plots whenever it comes to like the simulation results. Here on the x-axis, I have the percent censoring, and we can see that as censoring increases, the maximum likelihood estimator, it just kind of like does pretty bad when it comes to bias. And we can see that the weighted estimators, the AIPW estimators, as well as the IPW, they tend to perform better because we're able to kind of like estimate that nuisance distribution whose consistency it depends a lot better. Um, and whenever we kind of like check the coverage values, we see kind of like the same thing happening. Here are like some of the results whenever it comes to kind of like the actual numbers. So whenever like the IPW and the MLE they're correctly specified, we see that we observe very little bias, but the standard errors for the MLE as highlighted in green, they're lower than the IPW. And then for the AIPW estimator, we observe the same. We have like bias close to zero whenever it's correctly specified. And then the efficiency, we do observe like some efficiency gains in comparison to the IPW highlighted in yellow. We applied it to like our data of like Huntington disease, and the effect estimates, at least for the AIPW with lambda, they are a bit bigger. However, the standard errors for which we really wanted to kind of like nail down, we do some efficiency gains across the three estimators that we were like suggesting: the AIPW regular, the AIPW with that lambda matrix, and the MLE. I'll just add some final notes, and then I'll open the floor for questions. So I first showed you kind of like this plot, and then we were really trying to get an estimate that was as close as possible to this right corner. Well, first we established kind of like these estimators that we really never want to use, being the complete case, the MAC, the ACC, and the conditional mean imputation estimators. We were able to identify the IPW estimator from like in the field as this estimator that is not the most efficient, but it has some sort of robustness as it comes to this density function. And then we have the AIPW estimator, which requires the same density to be correctly specified in order to achieve robustness, but it's more efficient than the IPW estimator. And then lastly, we have this maximum likelihood estimator in which in high censoring rates, as I just showed you, it is the least robust estimator among the three, but it achieves the most efficient estimator. So in the paper, we do suggest for the AIPW with the lambda to be used at least for like the under high censoring rates, under dependent censoring, given that it's like the closest to kind of like the right corner. I'll just end with kind of like some future lines of research. And this is kind of like to one of the earlier questions that were done. So I started like this project maybe like a month or a little bit over a month ago with these people shown in the pictures. But we're interested in evaluating kind of like what is the probability of like higher educational attainment as a function of like a parent developing Huntington disease. So we have to remember that these children of families with Huntington disease, they don't only they have to kind of like maybe like care for their parents, but they are also at risk of developing the disease themselves. And if your parents start developing like symptoms at a very like early age, then that may affect your educational like outcomes. Um, and what's crazy is that there are like no studies of kind of like the societal impacts of Huntington disease on families in this area, much less in populations other than Caucasian. And this author, which is, her name is Abby. She was like the first person that wrote a paper comparing like the delay in diagnosis between like African Americans and white individuals, even though Huntington disease had been like studied since like the 1980s. And her paper just came out in 2022. So I reached out to this author and I was like, hey, you want to like look into this problem about like how is educational attainment like affected across different populations. And so we're working with this one, which is also a right-censored covariate problem because the age of the parent is not known at which they maybe develop symptoms. And we have kind of like about a 10% censoring rate in the data. And so we're first kind of like writing this applied paper when it comes to like evaluating the complete case estimator. There are no reasons as to like why maybe we think that the censoring is dependent with like the outcome. So this is kind of like a very like neat side project as it relates to the right-censored covariate problem. Um, Other sources of kind of like projects related to this is that, yeah, I just showed you kind of like all of this fancy math and a lot of these different estimates, they require like different densities, like for the censoring or the event process. But just because we're able to like point at it, it doesn't mean that it's identifiable. And in some cases, it may not be identifiable, meaning that we just don't have the enough data to be able to um, estimate this nuisance, this distribution of interest. So there's this other project with a master student of mine back at UNC, in which we're kind of like looking at identifiability conditions for each of these components of the models, because they may not be able to like be identified, and like you have all of these people using our estimator, but if they're not be able to kind of like be identified, then you automatically not have consistent results. And then I have like 3 research project lines, potentially like just throwing out their ideas in case people are interested in collaborating, at least in this topic. But the first one is kind of like this just very rich area of longitudinal, the joint modeling of survival and longitudinal data. So there may be benefits into like modeling all of these 3 outcomes jointly together. Most of the methods out there in the field, they just consider the joint modeling of Y and X, but they consider C as a fixed process, not a random process. So under the case of differential censoring, we have the opportunity to potentially investigate estimators in this area. Adjusting for the sandwich variance estimator. So this one is kind of like one of the nastier slides that I did not include in my research project. But on the paper, we also kind of like define, okay, what is going to be our estimate for like the standard errors, depending on whether we use different estimators to like estimate potentially the distribution of the censoring component. There's a lot more people nowadays using potentially like a random forest model to like estimate the probability of being censored in the data. And when we don't really have like neat expressions as to like what's potentially the estimating equation. We're not able to use like regular estimating equation kind of like theory to kind of like derive the sandwich variance estimator. So there's also like opportunity for that. And the last one is improving the robustness of estimators. Generally, when you read about like causal inference, all of these AIPW estimators, like they're doubly robust. In this case, we have single robustness, meaning that we always have to correctly specify the probability of observing a complete observation in order to like achieve consistency. And some of my colleagues back at UNC, they just developed kind of like the first AIPW estimator for the simpler case of outcome independent censoring that is doubly robust. But at least for like this harder case, there's kind of like room for like work and improvement. So I'll leave you with those thoughts, and I thank you so much for your time and attention.
So I don't know if you want to ask her.
Hello, are there any questions on the chat? Trent, do you want to follow up on your question, or are you good?
Thank you so much for this fascinating talk and this problem. I think I need to go read the paper, and then I come back to you with I would love to talk more about this, but I need to read the paper. Thank you.
I'm excited.
I think I was a bit confused because I accidentally thought it was Y that was right censored instead of X, as Trung mentioned in the chat. So I'm curious if there's an easy extension of this to when Y is right censored, or is that just not related?
That's an excellent question. So some of the first work out in the field, well, let me take a step back. So generally we see kind of like the outcome being right censored as opposed to kind of like the covariates. But in this case, we know like what the outcome is, but we have a right censored covariate. So we kind of like interchange the roles. And some of the first work out in the field was like, well, this is kind of like the same problem. So just go ahead and run a Cox proportional hazards model and deal with it. But the thing is that we're able to potentially like test for the effect of the covariate if you only have like your right sensor covariate and then your outcome, and then you kind of like flip them. If you were to run that Cox proportional hazards model, you can use that p-value to test the significance of the relationship between both of them. But you're not able to get an estimate for like your beta of interest because there's not a linear relationship, at least for like in the survival context within like the Cox survival model. So that was kind of like the first strategy. And then people were like, okay, well, we're able to get a p-value, but not the effect estimate. What are potentially like some ways in which we can kind of like take a step back from like the survival problem and potentially like modify some of these estimators from like the missing data to work in this kind of like hybrid between missing data and like survival problem.
So essentially, is this a problem of missing exposure?
Uh,
I mean,
right.
I shouldn't be talking about exposure outcome because you said you're not doing causal, but essentially, if we think about the outcome, which is sorry, not the X variable, which is diagnosis at some point in the future as representing, I mean, the person having always had it, which causes their kids to have to take care of them and things like that. Then X is sort of an exposure or like reflection of an exposure. Then it is a problem of missing exposure, right? So how does this work connect to work that has been done on missing exposure?
Yeah, and thank you for that question. I think that at least when we think about like exposure, like there's an underlying tone of kind of like temporality, mostly because I guess when we use kind of like exposure, we assume that it happened before the outcome. But at least in this case, like having that time to diagnosis as a variable in your model, it feels weird, kind of like, at least for me, labeling it as an exposure. And that's why potentially I kind of like consider it just like a covariate, like something that we want to adjust. We can kind of like think about it as a form of disease progression, sort of measurement that is aligning people to kind of like the same timeline. And at least when it comes to how it relates to the work that has been previously done, we do have a rich field of like missing data. I don't know what's older than the field of like missing data out there, but that was kind of like the first step into kind of like defining these estimators to begin with. And this paper, that was the first paper on my dissertation, kind of like focuses on like the instances in which this problem is the same and cases in which this problem is different. And I guess maybe just like very like high level where I picture is that at least whenever we have a covariate that is like right censored, we have a little bit tiny more information about why why are we not observing like the value? We at least know kind of like a lower bound of like what that value has to be. And using that tiny little amount of information, we can squeeze that in order to kind of like improve efficiency of just treating it as a missing data problem and discarding like the data just completely. So there's kind of like room for improvement in terms of kind of like efficiency results. But there's a lot of like settings in which consistency will not be affected if you were to just treat it as a missing data problem.
Thank you so much.
Mhm. Okay, Michael, did you want to ask your question?
Yeah, well, first, thank you for the excellent talk. And yeah, I just wanted to mention there is this paper from 1994 on estimation when you're missing some some regressors. And I was just wondering if there's or just putting it out there as a possibility to look at and compare or contrast with it, are the problems similarities between the problems that they look at and the ones you look at, and also if there are enough similarities, the comparisons of the methods.
Yes, and thank you so much for bringing this paper. This paper was probably like one that haunted me for I don't know how many months out of kind of like the 30 year because like first I wrote the paper and then I found these Rotniski papers like the series of the 1994, 1996,
Yeah.
1997. I was like, wow, I just redid all this work and potentially like someone had already done this before me like 20 years ago. But there are some subtle differences when it comes to I guess one, they just have kind of like these very like general expectations without kind of like not going into like what are each of these components actually change whenever it comes to potentially, okay, I'm estimating this probability as a Weibull accelerated failure time model. Like
Hmm.
kind of like no recommendations as to like how do we like estimate the covariance matrix or the sandwich variance estimator whenever we have kind of like these different forms of kind of like estimating these nuisance distributions. So at least when it comes to this general area of the Rotniski papers, at least paper number one is that it is very tangential to kind of like these papers, but at least like this second paper for which I mostly focus my talk today, we go a step further and kind of like just show, I guess, the explicit solutions of what are these augmentation terms. And then I also saw for like closed form expressions that may help accelerate the, I guess, like the computational speed.
That's great. Thank you. Yeah, I know that those foundational papers are quite general in their scope. So I'm not saying you're doing the same thing or even necessarily very similar. It's just, yeah, just curious what the relationship was. That's great. Thank you.
Yeah, thank you. Yeah, thank you. All right, thank you, everyone.